My name is Dr. John Stone. I'm a rheumatologist at the Massachusetts General Hospital in Boston and a professor of medicine at Harvard Medical School.
My name is Dr. Shauna Quinn. I'm a clinical scientist at Zenas Biopharma. In this video, Dr. Stone and I will discuss pancreatic IgG4-related disease, or IgG4-RD. In 2003, 7 patients in Japan with significant damage to their pancreas were discovered to have one thing in common. Each had evidence of inflammatory infiltrates within their pancreases enriched with a specific cell type, a type of cell called a plasma cell. More intriguing still, all of these cells bore on their surfaces a protein marker called immunoglobulin 4, or IgG4. Thus, the pancreas was the first organ recognized to be affected by IgG4-RD. Since that time, we have learned that IgG4-RD can affect almost any organ in the body. It is quite characteristic, however, for the disease to affect at least one, and often many, of the 10 to 12 organs listed here. In previous videos, we described that IgG4-RD occurs in about 1 in 8,000 people in the United States. Of all IgG4-RD cases, about half involve the pancreas, making it perhaps the most commonly affected organ. Because of the consequences of damage to the pancreas caused by IgG4-RD, involvement of the pancreas often leads to significant complications that we hope to avoid with early diagnosis, effective treatment, and careful management. I will start today with what the pancreas is and how it is impacted by pancreatic IgG4-RD. Dr. Stone will then continue with further descriptions of diagnosis and treatment of IgG4-RD. This is a representation of the pancreas. It is a miniature hockey stick-shaped organ that is situated in the abdomen, just below the stomach. The pancreas has 2 main functions, and they are both very important. One function is to monitor glucose or sugar levels and release insulin. When we eat a meal, glucose is absorbed into our blood, leading to a rise in blood sugar levels. The pancreas senses this rise and in response releases insulin, which instructs our bodies to take up and store the glucose for future use. If, however, the pancreas is damaged, it loses both its ability to monitor glucose and to make the insulin that regulates the glucose levels. The loss of the pancreas's ability to monitor blood glucose levels and make insulin in response to a meal is known as endocrine pancreatic failure, or diabetes. Diabetes can have many short and long-term complications. For this reason alone, it is very important to protect the pancreas. The second important function of the pancreas is to help with digestion. The pancreas makes proteins called digestive enzymes that are secreted into the intestines following a meal. These enzymes help to break down the fats and complex sugars that we eat. If we are unable to process these fats and complex sugars, then the intestines cannot absorb them. The undigested food causes diarrhea and abdominal cramping. Patients are unable to absorb the calories they need for good nutrition and become malnourished. Clinicians sometimes refer to the loss of the pancreatic's ability to make digestive enzymes as exocrine pancreatic failure. The long-term consequences of exocrine pancreatic failure are substantial, making the protection of adequate pancreatic function a crucial goal for patients with IgG4-RD. There is one related organ that is important to discuss when considering pancreatic IgG4-RD. This organ system, known as the bile ducts or the biliary system, are essentially pipes that connect the pancreas and liver to the intestines. The pancreas uses the bile ducts to release digestive enzymes into the intestines to help accomplish the goal of digesting food and absorbing nutrients. The liver also uses the bile duct system to excrete the bile acids, more commonly known as bile, into the intestines, also for the purpose of facilitating digestion. Most patients with pancreatic IgG4-RD also have biliary duct involvement in the disease. With advanced disease, the bile ducts become scarred and eventually blocked. Blockage of this normal flow of bile leads to congestion of bile and digestive enzymes in the liver and pancreas, causing damage within these organs. The condition of jaundice can also result from the impairment of normal bile flow through the bile ducts. Next, Dr. Stone will discuss how he diagnoses and treats pancreatic IgG4-RD. Dr. Stone?
Thank you for that excellent introduction, Dr. Quinn. IgG4-related disease can cause problems in multiple organs, but one can make a compelling argument that its effect in the pancreas and biliary tree are the most important. Certainly, these organs are among the most commonly affected. Understanding what the pancreas is and what it does is helpful in understanding how we should approach the diagnosis and management of pancreatic IgG4-related disease. Early pancreatic IgG4-related disease is often characterized by nonspecific abdominal pain in the area known as the epigastrium. The epigastrium is located right in the center of the upper abdomen. What I find striking about the pancreatitis of IgG4-related disease is how often patients have significant clinical disease in the pancreas, yet experience relatively few symptoms. This stands in marked contrast, for example, to the pancreatitis associated with excessive alcohol use or by the passage of gallstones through the biliary tree. Those causes of pancreatitis are usually associated with severe abdominal pain. Surprisingly, although some patients with IgG4-related pancreatitis are highly symptomatic, many are not. When we obtain abdominal CT scans on some patients with IgG4-related disease, we are sometimes surprised to find evidence of previous or ongoing pancreatic inflammation that patients are completely unaware of. Some patient CT scans show significant pancreatic atrophy. Others show signs of ongoing inflammation, swelling, edema, or mass lesions within the pancreas. In addition to the pain that is present in some patients with acute IgG4-related pancreatitis, other symptoms that can be present are a loss of appetite or anorexia and nausea. Chronic pancreatitis can be associated with other sets of symptoms: bloating and abdominal pain after eating, diarrhea, and weight loss. Patients simply cannot gain weight because they can't digest food properly in order to absorb nutrients and take in calories and nutrition. They have to take pancreatic enzyme replacement with every meal or snack in order to avoid these symptoms. We diagnose IgG4-related pancreatitis at both the acute and chronic stages. Sometimes the diagnosis of IgG4-related disease isn't made until the patient has already developed chronic, irreversible pancreatic damage. This is usually because the disease can be so subtle even when inflammation is active. Colleagues in Japan have likened the disease to being a dark crow flying through the night. That is very difficult to detect. But the entire time that the disease persists undetected, it's causing injury to the affected organs. When IgG4-related pancreatitis does lead to significant symptoms, imaging studies are frequently obtained to try to understand the source of the abdominal pain. The most common test for this purpose is a CT scan. Once a problem in the pancreas or biliary tree has been identified, doctors also sometimes order a special MRI examination called an MRCP. This permits the visualization and close inspection of the bile ducts within both the pancreas and the liver. In pancreatic IgG4-related disease, CT scans and other imaging studies sometimes show lesions in the pancreas or bile ducts that can be mistaken for a cancer. The two most common types of cancer that mimic IgG4-related disease in the pancreas and bile ducts are pancreatic cancer and a tumor of the bile ducts known as a cholangiocarcinoma. The possibility of having one of these cancers is obviously a source of tremendous concern and worry for patients. Some patients are even subjected to major surgical procedures before the correct diagnosis of IgG4-related disease and not cancer is established. Fortunately, when the diagnosis is really IgG4-related disease and not cancer, biopsies of these mass lesions don't show tumor cells, but rather reveal the pathology that is strongly suggestive of IgG4-related disease in the right context. At that point, you would come to a doctor like me to confirm the diagnosis and develop a plan for the treatment and management not only of issues in the pancreas and bile ducts, but of the IgG4-related disease overall. We cannot yet cure IgG4-related disease, but our ability to diagnose and treat this condition has improved dramatically over the last 20 years, from a time when no one even knew that the disease existed. One of my key roles as a physician who cares for patients with IgG4-related disease is to prevent disease flares and manage them quickly when they occur, so they don't lead to irreversible problems, threaten the performance of vital organs, or impair quality of life. Working together, the patient, doctor, and the rest of the care team can prevent pancreatic and bile duct damage and reduce the likelihood of bad outcomes for patients with IgG4-related disease. To control flares, we often start with an old but powerful drug called a corticosteroid. A common example of a corticosteroid is prednisone. This drug is very effective at controlling flares, but corticosteroids can have many side effects and you might not be able to tolerate them well. If that happens, we have additional options to control the immune system, such as azathioprine, mycophenolate, and rituximab. There are also clinical studies ongoing to evaluate potential future investigational treatments that may control IgG4-related disease more effectively. We will discuss these in a future video. In this video, we focused on pancreatic IgG4-related disease. In future videos, we'll discuss other commonly affected organs. I believe that knowledge is a powerful tool for every patient in understanding his or her fight with this condition. The partnership between the healthcare provider and the patient is critical in combating IgG4-related disease. Please refer to the links in our video description for a list of patient advocacy groups, clinical trials studying new therapies, and other patient resources. Thank you for watching, and I hope to talk to you again soon.